Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
My name is Chun Chiang. I am the medical director for Correctional Health Services, and I've been in this role since 2011. I went to school at Medical College of Wisconsin, and prior to that, I attended University of California, Irvine for undergrad, and finished my residency with Long Beach Memorial Family Medicine in the specialty of family medicine. I joined the county in 2006, initially as a PSC, Professional Service Contractor, and then about 4 or 5 months later, went full-time with the county in the PHMO role, the Public Health Medical Officer role. I went into family medicine because family medicine is the specialty that you get to build a relationship with and understand the entire family. It is a challenging specialty because you have to be trained and understand a wide variety of different subspecialties, from orthopedics to OBGYN. That wide spectrum of training positions the family medicine doctor to be in the center of a patient's healthcare and best able to help that patient navigate the complex healthcare system and help coordinate different subspecialty care that they would need. The population in corrections is the only population in this country that has a constitutional right to healthcare. No one else in the free world in this country has a constitutional right to healthcare, and this is mandated by the Supreme Court. So what we do has a lot to do with what the court feels is protecting an inmate's right. And not treating them appropriately can sometimes rise to violation of the 8th and the 14th Amendment, and can be deemed deliberate indifference, which is a violation of federal laws. So what we do is very deliberate in making sure that when we know a patient has a medically necessary treatment, that treatment is carried out in a timely manner that is consistent with community standard for that treatment, to make sure that we don't violate any state or federal laws. I think most people will be surprised that a lot of what I do deals with medical legal issues, and making sure the patients in our system are being treated fairly with regard to their healthcare treatments and their accommodations. Some of our patients, as you might imagine, disagree with our doctor's treatment plans, and all of them have an attorney. That's very different than patients on the outside. And so when these disagreements arise, we tend to have to deal with that patient's attorneys. And so my job is to make sure that the patient's medically necessary treatment is being carried out according to current community standards. And I do that on the outside too. I am sometimes called upon and asked to be expert witness in defending other jurisdictions from frivolous lawsuits, as well as reviewing cases to make sure that a patient within custody is or was receiving appropriate medically necessary treatment during that custody stay, and that's not sometimes not always the case. It takes a long time to get a doctor that's never been in the corrections up to speed on how to treat patients in corrections. There's a lot of things to consider with regard to their security status, where they're housed, what things that you would expect a patient to do at their home, you can't necessarily expect that patient to be able to do in the custody, which is their home at that time. So a lot of time has to go into orienting that patient, that doctor in learning how to treat that patient. And I feel I'm inspired by the fact that we're at this cusp of this field really developing into a full-fledged specialty, and I'm on that leading edge, shaping and defining where this field is going and that specialty is going, and to elevate, to have an impact in elevating the correctional healthcare standards across this country.